Roper St. Francis Healthcare's House Calls TV.
CyberKnife is a revolutionary new technology at Roper St. Francis, helping doctors deliver radiation to tumors once considered untreatable. Dr. Curtis Worthington explains.
Because the CyberKnife is so precise and so focused, because it's computer-based and based on very precise imaging, the radiation can be concentrated in the abnormal tissue only, and the normal tissue around it is spared from any radiation.
CyberKnife can treat tumors all over the body, including the brain, lungs, liver, and prostate.
What it involves is using intersecting beams of radiation to treat small tumors and other abnormalities.
And those intersecting beams reduce side effects and treatment time. Many patients require 1 or 2 visits with CyberKnife versus weeks with traditional therapy.
In many cases, you get a result that's better than you could have with either conventional radiation or with open surgery. And the side effects are close to none.
For more information, call 402-CARE. For House Calls TV, I'm Merritt Buck.
Roper St. Francis Healthcare's House Calls TV.
HealthBreak is brought to you by HCA Richmond Health System.
Across the nation, hospitals are focused on something called door-to-balloon time when treating a heart attack. This term refers to how long it takes between a patient's arrival and restoring a blood flow to the heart. Dr. Mark Newton discusses door-to-balloon time at the Levinson Heart Hospital.
Since 2005 at the Levinson Heart Hospital, we have put together a team to try to improve the process in which patients come in with heart attacks. If you get the blood vessel open under 90 minutes, you improve survival by 2 times.
Thanks to their dedication, times are constantly improving. In fact, recently the team was able to help a patient get from the door to the cath lab for an angioplasty to open the artery in just 14 minutes.
We've been focusing on this process for 3 years, and each year we've improved. In 2007, all quarters of the year we were under the 90-minute time. The Levinson Heart Hospital has been rated the #1 heart hospital in Virginia.
For more information or physician referral, call Medline at 1-800-242-5662 or visit hcarichmond.com. For HealthBreak, I'm Amy Watson.
HealthBreak was brought to you by HCA Richmond Health System. HealthBreak is brought to you by Skyline Medical Center of the TriStar Health System.
After successful treatment for breast cancer, Pam Williams was on several medications. She knew that some of them put her at risk for blood clots, but when the symptoms started, it was still difficult to diagnose.
I had noticed tightness in my neck every once in a while. That was my only symptom in the beginning, but things continued to progress. I started having swelling in my face.
Soon, a CT scan would find multiple blood clots, closing up vessels in her neck. She needed immediate treatment, so she looked to Dr. Dan Wunder at Skyline Medical Center and their new AngioJet technology.
The AngioJet is a specialized catheter that breaks up and sucks out blood clot from vessels in the body. It markedly reduces their hospitalization time, reduces their symptoms or alleviates their symptoms usually almost immediately, and is much more cost effective as compared to other therapies, including surgery.
As sick as I was, I had really immediate results from this. I think that my course of recovery was excellent.
For more information, call TriStar Medline at 342-1919. For HealthBreak, I'm Lynn Yates.
HealthBreak was brought to you by Skyline Medical Center of the TriStar Health System. HealthBreak is brought to you by the Heart Institute at Palmetto General Hospital.
The Heart Institute at Palmetto General Hospital offers advanced technology in their cardiac cath lab and smart ORs, but they also offer advanced ideas to help heart patients recover after these procedures. Dr. Romaldo Segurola describes the Institute's intensive care unit.
We have integrated the unit with the operating room. Real screen, real time. The nurse that is going to be accepting that patient is going to actually see what's going on in the operating room, It's going to see all the trends and vital signs that this patient has. And that could help you better understand the needs that that patient is going to have once he comes up to the unit.
This unit operates on a revolutionary universal bed concept.
Once the patient comes into the unit, the patient will leave the unit, and they don't have to be transferred to a step-down unit, a telemetry unit. There's very consistent care.
This concept allows patients to avoid the hassle of ever-changing rooms and floors. It also allows the caregivers to specialize in cardiac care and get to know their patients better.
That will be the room, his room or her room, until they leave the hospital. So they have the same nursing staff, the same physical therapist, the same dietitian.
For a physician referral, call 1-800-522-5292. For HealthBreak, I'm Beverly Herbert.
HealthBreak was brought to you by Palmetto General Hospital.